Welcome to biology class, children. Today we are going to learn a new lesson. Lesson number 3, Reproductive Health. Safe motherhood begins before conception with healthy lifestyle and proper nutrition. In this lesson, we are going to learn about reproductive health. Reproductive health is important. Why? Because people having physically and functionally normal reproductive organs only can produce healthier babies, and they can take care for their family, in turn for society and community. Reproductive system is controlled by neuroendocrine system, and hence we have to take necessary steps to protect them from the infection, disease and injury. So there is a need for the reproductive health, because if we don't take care of them, we may have to face many problems. The upcoming generation face problems, and we need to sort out these problems through strategies. So India has initiated family planning program since 1951, and this has been periodically assessed every 10 years, and they named this program as Reproductive and Child Health Care, RCHC. So major tasks that are carried out under this reproductive and child health care are: they create the awareness by providing medical assistance to the people who are bringing the next generation. So this will help to build a healthy society. Secondly, they introduce the sex education in schools to provide information about the adolescent and their related changes. Thirdly, educating the marriageable age group couples. By educating them, we can provide a healthy society. About available birth control methods and family planning norms are all informed. And this also helps to create awareness about the care for the pregnant women. Postnatal care of mother means after delivery, how to take care of the mother as well as the child, and also they insist upon the importance of breastfeeding. So this program also encourage and support governmental and non-governmental agencies to identify new methods or to improve upon the existing methods of the birth control. Amniocentesis. Due to small family norms, many couples have their choice for the male baby, because of which female population is decreasing at an alarming rate. Amniocentesis is actually a prenatal technique which is used to detect any abnormalities in the fetus, but it is being often misused to determine the sex of the fetus now. Once the sex is determined, there may be a chance of female feticide, and hence a statutory ban on amniocentesis is imposed. Social impact of sex ratio, female feticide and infanticide. In India, the female child sex ratio has decreased over the decade from 927 to 919 females for every 1000 males. To correct this ratio, steps have to be taken to change the mindset of young adult. Their attitudes must be changed over the girl babies. So female feticide and infanticide becomes a manifestation of gender discrimination in our society. What is female feticide? Aborting the female baby in the mother's womb itself is called as female feticide. What is female infanticide? Killing the female child after her birth is female infanticide. They both result in the imbalance of sex ratio. In UNDP's GII 2018 program reflected that India was ranking 135th out of 187 countries due to the unavailability of the economic opportunities to women when compared to men. So you have to learn the expansion of UNDP's GII, which is United Nations Developmental Program's Gender Inequality Index. PCPNDT Act, Preconception and Prenatal Diagnostic Technique Act 1994. So this in order to prevent the female feticide and infanticide. So Government of India has taken various steps to enact ban the identification of the sex to prevent the use of prenatal diagnostic technique for selective abortion, by which they can reduce the female feticide and infanticide. So various measures are taken by the government to ensure the survival, provision of better nutrition, education, protection, empowerment of girls by eliminating the differences in sex ratio, infant mortality rate, and improving their nutritional and educational status. POSCO Act, Prevention of Children from Sexual Offences. So Sexual Harassment at Workplace Prevention, Prohibition and Redressal Act, and the change in the criminal law based on the recommendation of Justice Verma Committee in 2013 aims to create a safe, secure environment for both male and females. Population explosion and birth control. What is population explosion? Increase in population. So how to reduce it? By birth control. So increased health facilities, better living conditions have enhanced longevity of a person. So because of this, population increases. According to a recent report from UN, India's population has already reached 1.26 billion and it is expected to become largest in the country's population, surpassing China around 2022. To overcome the population explosion, birth control is the only available solution. People should be motivated to have smaller families by using various contraceptive devices. Advertisement by the government in the media as well as the poster, bill, etc. with the slogan Naam iruvar namakkiruvar, we two as two, and Naam iruvar namakku oruvar, we two as one, has also motivated to control the population of Tamil Nadu. Statutory raising of the marriageable ages. So age of the marriage for male and female is increased. For female it is 18 years and for male it is 21 years. If you are having a small family, incentives are also will be given to the couples. And all these are the measures which are taken by the country. Now we shall see the birth control methods. What is birth control? The voluntary use of contraceptive procedures to prevent fertilization or prevent implantation of a fertilized egg in the uterus is termed as birth control, which is an ideal contraceptive. An ideal contraceptive should be user-friendly, easily available, with least side effects, and should not interfere with the sexual drive. So the contraceptive methods can be classified into two. They are temporary and permanent, and they can be of natural, chemical, mechanical, hormonal barrier methods. So all these temporarily control the birth. Birth control methods can be classified into temporary and permanent, and temporary methods are natural method, barrier method, and intrauterine devices. First we shall see which are all the natural methods. Periodic abstinence. Abstinence means keeping away from each other, male and female keeping away from each other. It is a rhythm method. Second method is continuous abstinence. Third one is coitus interrupts and lactational amenorrhea. First we shall learn the natural methods. It prevents the meeting of the sperm with the ovum. That first one is periodic abstinence or rhythm method. So we know that ovulation occurs at about 14th day of the menstrual cycle. So after ovulation, the ovum survives for about only 2 days, and the sperm can remain alive for only 72 hours in the female reproductive tract. So calculating this, coitus could be avoided. Second one is continuous abstinence. It is the simplest and most reliable way to avoid the pregnancy is not to have coitus for a definite period of time that will facilitate conception. Coitus means sexual union of the male and the female. Third one is coitus interruptus. It is the oldest family planning method. The male partner withdraws his penis before ejaculation, thereby preventing deposition of semen into the vagina. Next we have lactational amenorrhea. Menstrual cycle usually resumes as early as 6 to 8 weeks after delivery or parturition. However, this reappearance of the normal ovarian cycle may be delayed for 6 months during breastfeeding. So this delay of the ovarian cycle because of breastfeeding is called as lactational amenorrhea. So this lactational amenorrhea serves as a natural but an unreliable form of birth control. So breastfeeding will stimulate the pituitary gland to secrete the prolactin hormone in order to increase the milk production for the baby. So this high prolactin concentration in the mother's blood may prevent the menstrual cycle by suppressing the release of gonadotropin releasing hormone from the hypothalamus and gonadotropin secretion from the pituitary gland. Next we shall see the outline of barrier methods. Barrier methods consist of chemical barrier, mechanical barrier and hormonal barrier. Mechanical barrier can be attained using condoms, diaphragm, cervical caps and valves. Whereas hormonal barrier consists of oral contraceptives and mini pills. Next is barrier method. Here the ovum and the sperm are prevented from meeting so that the fertilization does not occur. It can be a chemical barrier. Chemical barrier examples are foaming tablets, melting suppositories, jellies, creams are used as chemical agent that inactivate the sperms in the vagina itself. Mechanical barrier. The condoms are the thin sheath used to cover the penis of the male and vagina of the female. This can prevent the conception, but condoms should be discarded after a single use. And it can also safeguard the user from the killer diseases like AIDS and other STDs. STD for sexually transmitted diseases. So condoms are usually made up of polyurethane, latex, lambskin. Diaphragm and cervical cups picture are here, and it is made up of rubber, and they are inserted inside the female reproductive tract to cover the cervix before coitus. Next is hormonal barriers. Hormonal barriers prevents the ovaries from releasing the ova, and it also thickens the cervical fluid which keeps the sperm away from the ovum. Oral contraceptives are in the form of pills used to prevent the ovulation by inhibiting the secretion of follicle stimulating hormone and luteinizing hormones. A combined pill is the most commonly used birth control pill. It contains synthetically produced progesterone and estrogen hormones. Sahili is the name of the contraceptive pills commonly used in India, and it is produced by Central Drug Research Institute, Lucknow. And it contains non-steroidal preparation called Centroman. Next we have the intrauterine devices, IUDs. These are inserted by the medical experts in the uterus of the female through the vagina. These devices can be available as copper releasing IUDs, hormone releasing IUDs, non-medicated IUDs. These IUDs commonly increase phagocytosis of the sperm within the uterus. Phagocytosis means cell eating, that means it kills the sperm. IUDs are ideal contraceptives for female who want to delay the pregnancy, and it is one of the most popularly used contraception in India and has a success rate of about 95 to 99%. Copper releasing IUDs, let us see what are they. So they differ from each other by the amount of copper present, and they release free copper copper salt into the uterus, and this will suppress the sperm motility. So they can remain in the uterus for 5 to 10 years. Example for copper releasing IUDs: CUT380A, Novati CU7, CUT380AG, Multilode 375, etc. Hormone releasing IUDs are often called as intrauterine systems (IUS). They increase the viscosity of the cervical mucus and thereby prevent the sperm being entering into the cervix. Example for this is Progestastat and LNG20. Non-medicated IUDs. They are made up of plastics and stainless steel. Lippy loops is a double S-shaped plastic device. Example for it. Birth control methods, permanent methods. So which are all the permanent methods? First one is surgical sterilization method. In that we have tubectomy and vasectomy. Permanent birth control methods. These are adopted by the individuals who don't want to have any more children. Surgical sterilization methods are the permanent contraceptive methods for male and female to prevent any more pregnancies. It blocks the transport of gametes and prevent conception. Tubectomy. It is a surgical sterilization in women. A small portion of the fallopian tube on both the sides are cut and tied up through a small incision in the abdomen or through vagina. So here you can see the tying up of the fallopian tube on both the sides, and this will prevent the fertilization as well as the entry of the egg into the uterus. Vasectomy. The surgical sterilization procedure for male. So both the vas deferens are cut and tied through small incision in the scrotum to prevent the entry of sperm into the urethra. The vasectomy prevents sperm from heading off the penis as the discharge has no sperms in it. And this is the mind map of the birth control methods. You can summarize through this. Next we have the medical termination of pregnancy or MTP. The medical method of abortion is a voluntary or intentional termination of the pregnancy in a non-surgical and non-invasive way. So early medical termination is extremely safe up to 12 weeks. That is during the first trimester. So generally it has no impact on the women's fertility. So abortion during the second trimester is more risky because the fetus becomes intimately associated with the maternal tissue. The government of India has legalized this MTP in 1971 for medical necessity and social consequences with certain restrictions like sex discrimination, illegal female feticide, and to avoid its misuse. The MTPs performed illegally by unqualified person is unsafe and could be fatal also. The MTPs of the first conception also have serious psychological consequences for the mother. Next we have the sexually transmitted diseases. Sexually transmitted diseases, or otherwise called as venereal diseases or reproductive tract infection, together they are called a sexually transmitted infection, STI. So normally STI are transmitted from person to person during intimate sexual contact with the infected person. So infections like hepatitis B, HIV are transmitted sexually as well as by sharing the infusion needle, surgical instrument, etc. with the infected people. Blood transfusion also causes infection, or it can be also transferred from the infected mother to the baby. People of the age 15 to 24 are more prone to this STD. Sexually transmitted infection. Bacterial STI. Example for it is gonorrhea, syphilis, chancroid, chlamydiasis, lymphogranuloma venerum. Protozoan STI, trichomoniasis. Fungal STI, candidiasis. STI caused by bacteria, fungi and protozoa can be treated with antibiotic and other medicine. Viral STI, genital herpes, genital warts, hepatitis B and AIDS. So STI by the virus cannot be treated, but the symptoms can be controlled by antiviral medication. Latex condom greatly reduces the risk of STI, viral STI, but it does not completely eliminate the risk of transmission. Prevention of STDs. First method, avoid sex with the unknown partner or multi-partners. Second one, by using condoms we can prevent STD. In case of doubt, consult a doctor for diagnosis and get complete treatment. So this is the list of the infected diseases of bacteria. So name of the disease gonorrhea and name, causative agents, symptoms of it, incubation period is listed in your book itself. We can go through it and learn. And these are the diseases which are caused by viral STI. Then fungal STI, candidiasis, and protozoan STI, trichomoniasis. Cervical cancer. So what is cervical cancer? So this is also caused by sexually transmitted virus called human papilloma virus. So HPV in short may cause abnormal growth of the cervical cells, or otherwise called as cervical dysplasia. The most common symptoms of the cervical cancer are pelvic pain, increased vaginal discharge, abnormal vaginal bleeding. The risk factors of the cervical cancer will include having multiple sexual partners, prolonged use of contraceptive pills. Cervical cancer can be diagnosed by Pap smear, combined with an HPV test. X-ray, CT scan, MRI, PET scan also may be useful to determine the different stages of this cancer. The treatment option for the cervical cancer will include radiation therapy, surgery, or chemotherapy. Modern screening techniques can also detect precancerous stages in the cervix. Therefore, screening is recommended for the women above the age of 30 once in a year. Cervical cancer can be prevented by vaccination also. Primary prevention begins with the HPV vaccination for girls of age 9 to 13 years before they become sexually active or attain puberty. Modification in the lifestyle can also help in the prevention of the cervical cancer. Healthy diet, avoiding tobacco usage, preventing early marriages, practicing monogamy, and regular exercise can minimize the risk of the cervical cancer. Infertility. Infertility means inability to produce children. The definition for it is inability to conceive or produce children even after unprotected sexual cohabitation is called infertility. That is why the inability of man to produce a sufficient number of or quality of sperm, or to impregnate a woman, or the inability of the women to become pregnant or maintain pregnancy. The causes for infertility are listed below. First one is tumor formed in the pituitary or the reproductive organs. Second one, inherited mutation of genes which has been transmitted from their parents are also responsible for the biosynthesis of sex hormones. And malformation of the cervix or the fallopian tubes. So in the body, if it is not formed properly, malformation of the cervix, fallopian tubes, and inadequate nutrition before adulthood. Long-term stress damage many aspects of health, especially menstrual cycle. Ingestion of toxins like heavy metal, cadmium, heavy use of alcohol, tobacco, marijuana, injuries to the gonads, and aging also become cause for infertility. Other causes are pelvic inflammatory disease (PID), uterine fibroid, endometriosis, low body fat or anorexia in women, psychiatric eating disorder characterized by the fear of gaining weight, undescended testes and swollen vein, varicocele in scrotum. Tight clothing in men may raise the temperature in the scrotum and affect the sperm production. And underdeveloped ovaries and testes may become the cause for infertility. Female may develop antibodies against her partner's sperm. Males may develop an autoimmune response to their own sperm. These are the causes for the infertility. Now we shall see what is ART, Assisted Reproductive Technology. A collection of procedure which will include handling of the gametes and embryos outside the body of the individual to achieve a pregnancy is called as Assisted Reproductive Technology. And this include a collection of techniques. This increase the chance of pregnancy in infertile couples. So ART includes first one, intrauterine insemination, IUI, in vitro fertilization (IVF), embryo transfer (ET), zygote intrafallopian transfer (ZIFT), gamete intrafallopian transfer (GIFT), intracytoplasmic sperm injection ICSI, pre-implantation genetic diagnosis, oocyte and sperm donation and surrogacy. So art will include all this. First one we shall see intrauterine insemination. So this procedure is to treat the infertile men with low sperm count. The semen is collected either from the husband or from an healthy donor, and it is introduced into the uterus through the vagina by a catheter after stimulating the ovaries to produce the ova. The sperm swim towards the fallopian tube to fertilize the egg, resulting in the normal pregnancy. The second one is in vitro fertilization or IVF, otherwise called as test tube baby. This technique, sperm and eggs are allowed to unite outside the body. In vitro means outside the body in a laboratory condition. One or more fertilized eggs may be transferred into the woman's uterus, where they may implant in the uterine lining and develop into embryo. Excess embryos may be cryopreserved, frozen for future use. Initially, IVF were used to treat the women with blocked, damaged and absent fallopian tubes. Today, IVF is used to treat many causes of infertility. The basic steps in the IVF treatment cycle are ovarian stimulation to produce the ovum, egg retrieval, fertilization, embryo culture and embryo transfer. The procedure starts with the egg retrieval, that is the taking up of the egg from the female body, and it is done by a minor surgery under general anesthesia using ultrasound guide after 34 to 37 hours of administering human chorionic gonadotropin injection. So the eggs are prepared and it is stripped off from the surrounding cell. So here you can see the egg is removed from the ovary of the female. Egg retrieval from female. Then at the same time sperm is also retrieved. Sperm preparation is done using a special media, and after preparing the sperm and the egg are brought together. Nearly 10,000 to 1 lakh motile sperms are needed for fertilizing one egg. So then zygote is allowed to divide to form 8-celled blastomere. Then this will be transferred into the uterus of for the successful pregnancy. The transfer of the embryo with more than 8 blastomere stage into uterus is called as embryo transfer technique. Now zygote intrafallopian transfer or ZIFT. As in IVF, the zygote up to 8 blastomere stage is transferred to the fallopian tube by the laparoscope. The zygote continues its natural division and migrates towards the uterus, where it will get implanted. So here you can see the keeping of the zygote in the fallopian tube by laparoscopic method, and this will be growing and dividing naturally, and it will migrate towards the uterus through this way, where it will get implanted in the uterine wall. The intrauterine transfer IUT. Embryo with more than 8 blastomeres is inserted into the uterus to complete further development. If it is more than 8 blastomeres, the zygote will be directly inserted into the uterus to complete the further development of the embryo. Gamete intrafallopian transfer or GIFT. Transfer of an ovum which is collected from a donor into the fallopian tube. So ovum may be collected from a donor and it will be inserted into the fallopian tube, and in this the eggs are collected from the ovaries and placed with the sperm in one of the fallopian tube. The zygote will travel towards the uterus and will get implanted into the inner lining of the uterus, and this we say as GIFT. Intracytoplasmic sperm injection. Normally the sperm will penetrate into the egg by itself, and with the acrosome it will dissolve the egg membrane and get inside the cytoplasm of the egg. But here it will be injected into the egg in a focal point, and it will get fertilized. Egg will get fertilized. The sperm is carefully injected into the cytoplasm of the egg, and fertilization occurs in the egg up to 75 to 85% with the sperm injected. The zygote which is formed will be allowed to divide to form 8-celled blastomere, and then it will be transferred into the uterus to develop into a embryo. Surrogacy. Surrogacy is a method of assisted reproduction. So we call in Tamil as Vadagai Thai. It is an agreement whereby a woman will agree to carry a pregnancy for another person who is actual mother of that child. Through in vitro fertilization, embryos are created in the lab and are transferred into the surrogate mother's uterus. Male infertility. A condition which is called as azoospermia is defined as the absence of spermatozoa, and this is seen in the 1% of the population. Microtesticular sperm extraction, TESE. In this, a small midline incision is made in the scrotum through which both the testicles can be seen. So under the microscope, seminiferous tubules are dilated and a small amount of testicular tissue in that area of active sperm production is removed and is improved for the sperm meal to produce viable sperms. Detection of fetal disorder during early pregnancy. So fetus, whether it is growing normally or any disorder, is found using many instruments. One such is ultrasound scanning. Ultrasound has no known risk other than the mild discomfort due to the pressure from the transducer on the abdomen. There is no radiation in this procedure. Ultrasonography is usually performed in the first trimester for dating, determination of the number of fetuses, and also for the assessment of early pregnancy complications. Amniocentesis is a technique by taking a small sample of amniotic fluid that surrounds a fetus. Chromosomal abnormalities can be diagnosed. It is generally performed in a pregnant woman between 15th to 20th weeks of pregnancy by inserting a long thin needle through the abdomen into the amniotic sac to withdraw a small amount of amniotic fluid. We can perform this amniocentesis. Amniotic fluid contains the cells which are shredded from the embryo or the fetus. Chorionic villus sampling or CVS. CVS is a prenatal test that will involve taking a sample of a placental tissue to test the chromosomal abnormalities. So placental tissue will be taken from this region. Fetoscope. It is used to monitor the fetal heart rate and other functions during pregnancy and labor. The average fetal heart rate is between 120 to 160 beats per minute. An abnormal fetal heart rate or the pattern may mean that fetus is not getting enough oxygen, and it also indicates other problems. A handheld Doppler device is often used during prenatal visit to count the fetal heart rate. During labor, continuous electronic fetal monitoring is often used. Cryopreservation or freezing of embryos. So it is often used when there are more embryos than needed for a single IVF transfer. So this will provide an additional opportunity for pregnancy through frozen embryo transfer or FET without undergoing another ovarian stimulation or retrieval. All women are born with ovaries, but some do not have functional uterus, and this condition is called as Mayer-Rokitansky syndrome.